Hello again, once again in 2024. We are here again, Councilman Danley, and we had a great guest today. And for our viewing audience, this is 2024 Continuing Moments of Black History. And our guest today is Dr. McFarland. And I'll let you introduce Dr. McFarland, Councilman.
All right. Thank you, Councilman Davis. This is really nice to be here again with our audience, the city of Douglasville, in the year 2024. This year, our focus is on health with your heart. So heart awareness. And we are so excited that we have with us today, we're interviewing Dr. Katherine McFarland. And Dr. McFarland, just tell us a little bit about yourself.
Well, first I'd like to thank you both for letting me come and speak about my heart's passion, which is heart disease. I've been a practicing cardiologist since 2004. I've studied all over Minnesota, Arizona, North Carolina, Kentucky, and finally settled in Georgia. And I've been here for the last 10 years, and it's been an awesome experience to be here. And now this last year, 2023, I started my own practice in Douglasville, right off a hospital drive. So I'm getting ingrained in the community and just happy to be here.
That's wonderful. So we're excited that she is in Douglasville, right, Councilman Davis?
Yes.
So Dr. McFarland, so can you just tell our audience where you're located in Douglasville?
Sure. I'm actually across the street from the courthouse.
Oh, how convenient.
Yes, 8687 Hospital Drive, Suite 102, Douglasville.
Wow. That is awesome. We are so excited that you are here with us. So as we're focusing on Black history, tell us who is your favorite, or just can you name one of your favorite heroes?
So I'm going to try to sum it up as best I can. You know, mentorship is so important. And I think back about mentors when I was in med school and people that let me shadow them and follow them. And they were really pioneers. Dr. Cassius Ellis was one of the first African-American men to be a surgeon at the University of Minnesota.
Wow.
And he allowed me to come and work with him, and that was just fantastic. And then I also wanted to mention someone else who was really important in the field of cardiology. Levi Watkins was the first African-American med student at Vanderbilt.
Wow.
And the first cardiac surgery resident at Johns Hopkins. And he implanted the first automatic defibrillator in a human being, and that was in 1980. And he believed in mentorship, he believed in diversity, and he worked tirelessly to make sure that people of color were represented in med school and across residency programs.
Oh, wow. Councilman Davis, feel free, jump in.
I'm just so impressed, Dr. McFarland. Give me a little history about where you grew up and what inspired you to go on with your legacy.
Question. Very good.
So I'm from St. Paul, Minnesota, and I grew up in the Rondo community. My parents, my father and my mother, started their wedded life in the Rondo community, which was an African-American community of mostly middle-class workers that worked on the railroad. And so growing up in that atmosphere was just awesome because there were so many professionals that were in that area. And then my father was a hard-working man. He had 3 jobs and worked himself all the way up with Northwestern Bell. And he was the one that really inspired me. He said, now we have to think about careers where you can be your own boss. And at that time when he was telling me that, you know, the only 2 alternatives were really medicine and law. And so I listened to him, I got into medicine, and medicine kind of over time has morphed into physicians not really having control. And So now we're coming full circle. Now that I've opened up my own practice, now I feel like we're back in a position of control. And so I thank God for my roots. I thank God for parents that supported us and really pushed us to be the best that we could be.
And I have another question, Dr. McFarland. What college did you study, and where did you do your residence?
Oh,
So I went a couple of different places. I really wanted to come south. And so when I was thinking about med school, I applied to a lot of different places, but because financially it made more sense to stay in Minnesota, I stayed there. But then after med school, I came to Wake Forest Baptist Medical Center in Winston-Salem, and it was a great experience. That was the first time I had ever witnessed 4 equal seasons, right? Winter, spring, summer, and fall, because Minnesota was not like that. And I knew that initially, once I finished training, I would go back there. And then I went on to the University of Kentucky to do my cardiology fellowship for 3 years, and then came back and worked in High Point, North Carolina for about 9 to 10 years before coming here.
wow.
Wow, that's awesome.
Oh, Wake Forest is beautiful.
It
It
is.
is beautiful there.
Okay.
All right, so Dr. McFarland, you are planning an event
Yes.
in this month.
Yes.
So tell us a little bit about why you're planning it, and give us some details for our listening audience on where is it going to be and what to expect, and then maybe is this something you're going to do each year?
Yes. So we happen to be doing this in the Douglasville Conference Center, and our event is going to be on February 10th in the ballroom here at this location.
Yay.
I have been doing for most of my career luncheons and fashion shows, because February is Heart Awareness Month, and it's really about getting people to understand that coronary artery disease and the spectrum of diseases, they're the #1 killers among men and women, not only in the US, but worldwide. And so we need to get the message out about heart disease. So we want to do it in an informational way, but we also want people to have fun. So we will have a fashion show, so there'll be a red carpet, and there'll be men and women walking down the runway. There will be a heart-healthy lunch.
Oh.
And then we will have a guest speaker to talk about a very important aspect. This year, the discussion will be around mortality from women, African American women having children.
Wow.
So we are starting to see that the rates of death are rising in African American women, and so we need to get the word out about the importance of making sure that you are checked and you're seen and your blood pressure is under control. So that's the agenda for this first inaugural year.
Oh, wow.
And we will be doing it every year.
Great.
So
So I am sure that we have a great conference center, and
Yes.
I am sure you're going to have a great time, and we hope that you'll come back and have your event here each year. Isn't it right, Councilman Davis?
Yes.
Yes, we
Yes.
want. So you mentioned the event, and you've brought some information. Is this where our
Yes.
audience can cue in?
Yeah, so this is our QR code. They can scan the QR code. They can also go to our website, www.kccwc.com, and they'll get a lot of information about the event, and they can purchase their tickets at that time. And we'll also have more information on Facebook and Instagram as well.
Okay, great. So slow down a little bit and tell us the link that they can go to the website. You said.
Okay.
Okay.
So it's www.kccwc.com, and that stands for Kingdom Cardiovascular Care and Wellness Center. That's the name of our practice.
Perfect. Well, I cannot wait. So something you said just a moment ago is you're focusing on immortality with African American women. And we know that heart disease is the #1 killer So, but in African Americans, tell us a little bit about that. Why do you think African Americans are in the highest number of diagnosis of heart disease and also deaths? How did African Americans get there, and what do we need to do as a prevention? Yes, come to your event, but how can we prevent? Just talk about that just a little bit.
So it's really complex, but there's a lot of different issues that have brought people of color to this place where they're more predisposed to cardiac arrests and heart attacks and death from cardiovascular reasons, some of which include lack of access to care and then delay of care as well. So we know that there are many risk factors that lead to coronary artery disease: hypertension, diabetes, high cholesterol, smoking, obesity, and we need to be able to combat these things and do things to prevent these different conditions that lead to coronary artery disease. We cannot change our family history, and there's a lot of family history related to coronary artery disease, but everything else we can change. We can take our medicines, we can exercise, we can make sure we're cutting down on carbohydrates and sugars. We can do a lot of different things, but if we don't know we have a problem and then we discover too late, then that's a big issue.
Kind of hard to go back and correct a lot of times. I know in my family personally, heart disease is very evident. So I've worked very hard on making sure that I eat the right food. I splurge every once in a while, but it is very evident in my family. What about you, Councilman Davis?
Well, I'm trying to get a diet together. Dr. McFarland, what is the basic diet for
Very good question.
prevention?
So we like the Mediterranean diet. So it's a diet that is high in fruits and vegetables, lean cuts of meat, whole grains, yogurt, nuts, olive oil instead of other oils. And it's not just a diet, it's a lifestyle change. Diets don't work, but when you make lifestyle changes, then that's something that's transformative and longer lasting. So.
Oh, good. Yes.
Yeah, and I've just last year in 2023, we've heard, and I know this has been going on, but I see the numbers are increasing even more. You have young children and teenagers, especially those that are participating in athletics, where they are experiencing heart issues, passing out on the basketball court. One of the gentlemen that had the heart issue on the football field.
Damar Hamlin.
Yes.
Yeah.
So, and you're welcome to share.
Sure.
I mean, what do you see with our teens and our athletes?
Sure. So there's a few things. Our kids are not getting the same amount of exercise that we got when we were younger. We were always outside playing. Someone called out and said dinner's ready, and we came in. Maybe we didn't want to come in, but we came in.
That is right.
But now there's so many children that this is the only exercise that they get, and this is the problem when they're sitting, they're inactive, they're eating, and they're not doing anything physical. There's so many people that are starting to see obesity and early onset diabetes, early onset hypertension, and early onset cholesterol because of the lack of activity. So we've got to be able to get our children more active. Kingdom Cardiovascular Care and Wellness Center is committed to doing that. We have been out in the school system talking about the importance of diet and exercise and staying away from, alcohol, tobacco, things that can be hazardous to your health. But we're also planning some things for later on in 2024, Youth Activity Day awareness, where we can talk to parents and children about increasing the exercise and getting their children active so we can combat obesity and high blood pressure as well.
So what about the athletes that are active and they go and they have their check with their doctor before they play and everything's checked out, and then all of a sudden, boom, you have this episode and it's like, I didn't know.
Yeah, so a lot of times athletes will have screenings beforehand, but not everything has been looked into. Sometimes it's a family history, sometimes it's sudden cardiac death that has happened in a family, but usually an EKG should be the first thing that's done, and then after that an echo, a picture of the heart, and then an evaluation by a cardiologist if someone has had an episode where a family member has passed out. That might be an abnormal heart rhythm, it might be a problem with the muscle and an enlargement of the heart that's unhealthy. And so anyone that has that type of background really needs to be checked.
And I know in African Americans or in people of color in my family, and we've changed the way we do things, a lot of times we don't talk about our history to each other.
Yes.
Like I'm not sure why, we just don't. It's how we do now, but we have not in the past, I think, done enough to say, your grandma did this, your mom, and I think now just being proactive, I see that more in my family because we've had, my brother passed away of a massive heart attack. So that just prompted us to want to do more, but just start talking and sharing history is very important.
It is very important, and it's a barrier because when we sit down and we see a new person in the clinic, that is a big part of what we talk about is family history. We go back 3 generations. We want to know what's in the family so that we can be prepared and be able to treat it if it pops up. So really it's an education issue. We need to be able to tell people that it's not that we're being nosy, it's not that people are trying to get in your business, but we need to have this family history so we can prevent some of the things that happen to relatives that are no longer here.
Right.
Dr. McFarland, to our viewing audience, can you just give us what are the signs?
Good question.
What are the signs?
Sure. So sometimes men and women can have the same symptoms and sometimes they can have different symptoms. Classic symptoms of someone having heart issues are chest pain, pain that initiates right here in the chest. It might also go to the shoulder or down the arm or up into the neck or jaw, and even pain into the back. Sometimes they can feel clammy. Sometimes they can get short of breath or feel lightheaded. They can even pass out. And sometimes they can have stuttering pain where they're exerting themselves and then they feel this heaviness or pressure in their chest, and then when they stop, it goes away. They can also have the same kind of symptoms if they're very stressed. And so those are classic signs and symptoms. Women can have different symptoms. They may just feel fatigued. They might be tired. They can't muster up the energy to walk up a hill. They don't know exactly what's wrong, but when they come to the physician, depending on what their age and risk factors are, that should be, a signal, hey, let's check their heart because there could be a problem.
Yes. So there's really no age limit.
There's no age limit, but we are starting to see heart attacks happen earlier. It used to just be people that were Medicare age, but in the coronary artery disease belt, which is the South, you can see disease earlier, even in 30s. My youngest patient, and this was back in North Carolina, she was 29 years old and she had a heart attack. That's very, very young.
Goodness.
Dr. McFarland, you just stated that You said something about the heart belt in the South. What does that mean?
So it means that people in the South are predisposed to have more issues with their heart because of the diet, because of the lifestyle. You know, so when you're, you know,
At the beach.
well, not even at the beach, but, you know, pork, fried
chicken.
foods, you know, eating with sideboards on your plate.
Yes.
You know, the portions, the lack of exercise, that can predispose people as well.
I didn't know that it was heavier in the South.
Yeah.
I
I mean,
didn't.
I just, the
Didn't have
belt,
a clue.
that's really,
I didn't have a clue.
wow. So tell us, how did Kingdom Cardiovascular Wellness Center get started? Because that is the name of your practice.
Sure. It was a labor of love, and I tell you, at first I didn't want to do it. I was supposed to do this in 2020, but I'm human. I got scared.
Cold feet.
Yep, I have 2 little boys. They're 12 years old, and I really just wanted to be comfortable.
You have twins?
They're 7.5 months apart.
You have twins?
One is adopted,
Aw.
and the other one is,
How adorable.
you know, my son too.
Yes.
So, but I wanted to just take care of my family and make sure that I could provide for them. But increasingly, I saw that it was very difficult to take care of people the way they deserve to be taken care of in a 10-minute span of time. You need to be able to bond with your patient. You need to be able to talk to your patient, and you need to be able to answer your patient's questions. In 10 minutes, you can't do that. You can't get an elderly person from the waiting room into the clinic room in 10 minutes, and let alone treat them and bond and form a doctor-patient relationship. And so really I just took a notepad and I thought about all of the things that I would want for my mother.
Yes.
And started birthing this on paper.
Wow.
And it came into fruition in the middle of 2022, and I was in my
Right after
office.
COVID.
Yes, right after COVID. And I was in my office on January 2nd, 2023, starting to see patients.
Wow. So what does it look like if Councilman Davis and I said, oh, let's go try out Dr. McFarland? What does it look like when a patient walks in your office? Because you said you didn't want to do like the 10-minute. And you get that when you go to the doctor's office sometime, maybe 15. But what does it look like?
It's like you're walking into a home. It's very peaceful there. We want to love on you when you come through the door. Doesn't matter if you're old or young. We really emphasize teaching. So I've got great big dry erase boards in the room so
Wow.
that the patient and the family members can get an idea of what is high blood pressure, what is diabetes, what is high cholesterol, what's the plan, and then they can snap a picture of everything that we talked about, what the plan is, so that if someone's on the phone with the patient that's there, they can bring that back and show them, so everybody's on board. We do stress tests in the office, we do echoes in the office, we do monitors in the office, and it's just in a very warm and inviting and intimate setting.
Wow, that's
Nice.
just for you to say
Yeah.
it feels like home and comfortable. You won me right there.
Well, thank you.
So now that we have Heart Awareness Month is important. And so Dr. McFarland, share with us why awareness should be on a broader stage.
So I'm going to kind of approach it in a slightly different way. So for over 20 years, we have been seeing breast cancer awareness in the month of October. We see football players wearing pink socks and pink gloves during the football season. And there's lots of messages that go out. There's lots of finances that go to the awareness of breast cancer. I believe the American Heart Association is doing a good job, but I think that we need to be on a larger scale. When Damar Hamlin had his event last year on January 2nd, that was a critical time. That was the time to say, hey, this has come to the forefront, it's happened to one of our players, and the day of the Super Bowl, let's make the Super Bowl red. Let's have, red jerseys.
That's a great idea.
Let's make sure that while everybody's getting ready for the halftime show, that there's a 2 or 3 minute, video about coronary artery disease and the spectrum of diseases, because that is the most watched event in February.
Right.
And I kind of feel like the ball was dropped when Damar Hamlin had his event. There could have been more done at that time. And it's hard for us as individual physicians to get the word out. We try, but we need a larger platform to do that. The Super Bowl is perfect, and I think it was just a missed opportunity. They touched on it, but they didn't go in depth. And that's what we need. We need people that are willing to go in depth about coronary artery disease, all of the risk factors, who it impacts. And it doesn't just impact the person that is having the event, it impacts the family. If that person doesn't survive, then there's a void left in the family.
Right.
So I just believe that awareness is so important, and we really need to be doing events like the, Red Awards, and try to do it in different ways, not just in February, all year round.
All year round.
Yeah.
So, you mentioned that stress is these weren't your exact words, but stress is a silent killer. And Councilman Davis and I, our schedules are real busy. I think his schedule is a whole lot busier than mine. So it's possible that you may not have heart disease or have been diagnosed or high cholesterol or diabetes, but just that stress piece can still impact your heart.
Yes.
So it's really important that we have a balance. Would you
Yeah.
agree?
Oh, I definitely agree. So it's all about finding the time. And some people would not be able to find maybe 30 minutes at one time, but you can find 3 10-minute opportunities in your day to go for a walk. 30 minutes out of your day is, 2 to 3% of your time.
Turn the phone off.
Yeah. Just like you pencil in an appointment,
Oh, that's a great idea.
you can pencil in your exercise.
And that is not just for Black History, that is just for everyone.
That's for everyone.
What percentage
Good
of
question.
Afro-Americans,
Good question.
Afro-Americans
Been
is there?
diagnosed with heart disease?
Yeah.
already?
Gosh, I mean, it's high.
It's high.
40,
People of color.
50%, yeah.
When I
mean,
think of people of color, I think of African Americans, Hispanic.
yeah,
Those numbers are extremely high.
they're extremely high. COVID was a time that really heightened our awareness. So if people don't have insurance, or they have limited insurance, or they have a good insurance plan but they don't go, you don't know what kind of risks you have. And when COVID happened, there was a predilection towards people with pre-existing conditions.
Right.
And so a lot of times when people are going in, they're finding out you got high blood pressure, you got diabetes, you got high cholesterol all at the same time, and it hits you like that.
On top of COVID.
On top of COVID, so we have to be able to go get checked so we can know what we're dealing with, so we can know how we need to combat these illnesses, how we can control them, and if we can catch them before they turn into disease. Diabetes, before it's diabetes, it's pre-diabetes. So it's like being able to catch these things ahead of time so you can do something about it. And that's the problem when we're not getting checked, when we're not being assessed. Even, you know, if you get 2 or 3 visits a year and you get a preventative screening and you get blood work, use it. That's your benefit. You're paying for it every month and you should get something out of it. You need to know what your health is like so that you can optimize it if there's a problem.
Right. Wow.
And you mentioned insurance. You take all insurance?
Yes, sir. We take all insurances.
That's
Okay,
wonderful.
Yep.
You know, in our ward, and it's really when you talk about access, and we've been working very diligently on getting like an immediate care or a place where people can go and get fresh fruit and fresh vegetables. And you know, our ward is considered a food desert. So what can we do in our ward, and not just in our ward, we have 5 wards, but what can we do to help you get the word out in the city of Douglasville? What do you see as far as partnering, and what do we need to do to help?
So I think partnering can be done in several ways. Right now, already, Kingdom Cardiovascular Care is partnering with the city of Douglasville to do Walk/Run with Your Doctor in conjunction with Walk with a Doc program, and that's at Ike Owings Community Center.
Oh, at Hunter Park.
Yep, Hunter Park. So once a month, we are out on a Saturday, not only walking with the community members, but we're educating the community members about different topics: high blood pressure, diabetes, fibroids. We had, you know, a OBGYN come in and talk to people about, you know, breast cancer. So there's a lot of different ways that we can get the word out. We're also partnering with schools. We want to go into the school system and have conversations with the health classes, have conversations with, you know, teachers and parents on, you know, PTA night, because it's about finding different ways to get the word out and get the message out, because the more people that are aware, then you can do something about it.
So she's doing, Dr. McFarland is actively partnering with the city of Douglasville at Hunter Park. Now, Councilman Davis, this is like a perfect moment for you to share with Dr. McFarland about Jesse Davis Park and what's coming, so we can get her to come to our park. I mean, another park in the city of Douglasville, not our
And that's
park.
in the New Horizon District,
Okay.
which is our district, New Horizon. And the park is being renovated, and there would be room enough for activities for the seniors, for the young adults,
Oh, awesome.
and the male adults with basketball.
Okay.
And we would stop the game and call you in and say, fellas, sit down and let's have a conversation.
Absolutely.
Go ahead, Councilman Davis, talking like
That's
it's some
important.
traction going.
Yeah, let's
Yeah,
have a
because-
conversation.
Yeah, because we need to have conversations in different areas. So the Red Dress Award event, that's one, but wouldn't it be great to open up a barber shop and then have men come in, because that's really where conversations happen, right?
So, Councilman
right.
And
Davis,
then talk about it. You know, so I would love that, because we've got to reach lots of people in lots of different areas to get the word out.
oh my,
Yes, I would
Councilman
love
Davis, that
that.
means you have 2 checks. So Jesse Davis Park was named after Councilman Davis' father. And you hit
okay.
on barber, so this is another moment for Councilman Davis to, okay, he is a licensed master barber
Oh, wow. Oh,
In the same New Horizon
in the
district.
city
okay.
of Douglasville.
That's perfect.
Yes.
So I would love, we would love to partner up with you, Dr. McFarland, and 2024.
Sounds great.
And let's make it happen.
Yeah,
Absolutely.
And the new senior center will be right there at Jesse Davis Park. And currently, AARP, they have a lot of activities going on. They have the sneaker walk, and they are very, very active. Seniors are
Okay.
loyal.
Okay,
So
yes,
that would
yes,
be
they
great
are.
to have you over.
Yeah.
Well, this has been very informative. It's been wonderful. Dr. McFarland, I will yield my comments unless Councilman Davis has any.
I've just been so overwhelmed, and Thanks again, Dr. McFarland. We have to do more chats.
Absolutely.
It's our chat and chew.
Be my pleasure. I thank you very much. I
Yes.
appreciate
Are there any
you.
final words you'd like to say to our listening audience?
Just come on out to our event, February 10th at the Douglasville Conference Ballroom. It's going to be fun, fashion, and awareness, and we expect to have a great time.
Wonderful. This has been awesome. So another year of continuing moments in African American history with Councilman Davis, and I am Councilwoman Dr. LaShawn Danley. Thank you so much for being so attentive and listening to the wonderful Dr. McFarland, who is the doctor at Kingdom Cardiovascular Wellness Center. I cannot wait to hear more, and I am sure there's a listener out here who've heard something about cardiovascular. Don't be afraid. Take the first step and do something for prevention, not just for yourself, but for your children, your grandchildren,
Yes.
and those that are coming and gonna live. We have to do it. So I am committed, Dr. McFarland. You're in, Councilman
Thank you
Davis?
for our continuing moments of Black History Month. And this is one of the first, so there's many to come.
Yes.
In the meanwhile, we'll see you.
All right. Thank you so much.
Thank you.
Bye-bye now.